From the start of the pandemic in March of 2020, the coronavirus has impacted so many families, so many nurses, really just so many people here in St. Tammany Parish. And we wanted to offer a glimpse into that reality that so many are facing still to this day. Joining me now is Hannah, an ICU nurse from Slidell Memorial Hospital. Thanks for joining us today.
Thank you for having me. Thank you.
Let's jump right into the start, March of 2020. What's going through your mind as you're seeing these cases popping up in your area?
Fear. You know, I was actually on a travel assignment, and my first day that I came back to Slidell was when the very first case of COVID came. I was assigned to the first patient, and I was scared. You know, we all were. We didn't know what was going to happen. It was all new to us. We had to, you know, every day it was something different. It was, you know, the first day was full-blown PPE, mask, gown, goggles, gloves, everything. They had to watch us how we took it off. You know, it was just it was just crazy how scary this was, because this was this new virus that was so contagious. And, you know, and then the next day it was, oh wait, you only need a surgical mask. And so even, you know, our doctors, and they had never seen this before. No one had. So we were just trying day by day, and it was like the rules changed each day. Oh wait, no, now it is airborne contact and isolation. So not just a surgical mask. Now it's all your PPE again. And, you know, and it was one case, and then it was, and then it was, you know, 2 cases, and then it was 3, and then all of a sudden the ER's full. And, you know, these patients, they, you know, when they came in very, very ill, they were directly admitted to the ICU when we had the beds. You know, we tried to keep it all in one unit in the beginning. And then I can remember the patients would be on 2 liters of oxygen, you know, which is a very small amount. And within hours, we were running to these rooms, and we were, you know, intubating, putting people on mechanical life support, you know, one after the other after the other. It was nonstop, and it quickly just overwhelmed us. We had no clue what we were up against. We tried, you know, when a new medication came out, or, you know, we'll try this, try that. It was like we gave everything we had, and the patients just kept getting sick, and people just kept dying. And it was so defeating, because we didn't know what to do then. We had no clue. We just went to work every single day just at a loss, because we tried our best, and sometimes no matter what we did, they never got better. And it was so scary. It was the scariest time in my career, and in a lot of people's careers, because it was something that it was just so new. It was brand new. We didn't know what to do.
We had the first surge, obviously, in March of 2020, and the summer brought a second, and the end of the year brought a third. You know, I imagine it had to feel like an emotional roller coaster going to work every day.
It did. It did. You know, my mother was diagnosed with cancer during the pandemic, actually right when it started, and she lived with me at the time. So I had to put her somewhere and keep her safe, and it was a fear. You didn't know if you couldn't hug your loved ones, because we were direct contact. There was no go home, be safe, quarantine for us. We didn't have that choice. We had to come. And we wanted to come because we wanted to be there for the community and for the people who needed us. And, you know, but we didn't know if we were going to infect those around us. It was just so emotional, and not just the fear of us infecting the people around us, but the emotions of seeing so many family members of all different ages and all different ethnicities. It didn't matter. There was just some that they were getting so ill that we couldn't save them all.
When did you think, in your mind, that things were starting to get better?
When the vaccine came out. When the vaccine came, and it was truly like a victory. Every single day we were defeated. And I remember I was one of the first ones to sign up. I was just so pumped, and it felt like finally we would start to see some light at the end of the tunnel. It felt like finally we have something that can help, that can save lives. And, you know, a lot of us got vaccinated, and we did start to see a decrease in cases. You know, we all just got to enjoy a few months where COVID wasn't so bad, you know, going spring and into summer, and it felt good. but then it came back, and it mutated, and it came back, and it came back stronger.
More fear involved this time?
100%. There's, people were saying that we have, the first time it was, in your 50s and your 60s or older, if you're immunocompromised, if you have, hypertension, diabetes, or obesity, were these major risk factors. We're not seeing that at all now, at all. We have patients in their 20s that are dying. We have 30s, 40s, people who haven't had any underlying conditions, who are healthy individuals. This virus this mutation is not discriminating at all. It has no, if anyone in its path that comes across of it, if you're not vaccinated, there's no safe way to say that, okay, you might do okay because you're young and you're healthy. We can't say that now. We can't.
I imagine being a nurse, you're prepared for somebody to lose their battle with whatever they're facing, but you're not prepared to be the person that's with them, the only person that's with them.
A lot of times we've been the last face that these people have seen. A lot of these patients, we can tell when they're getting sicker before. We know that they need to go this amount of oxygen. If they're on a nasal cannula, then they go to what we call a vapotherm or a BiPAP. These patients are usually, they're still awake. And we know, because we're watching their levels, we know that they're not tolerating it anymore, and that they need to go on a ventilator. They need to go on a mechanical life support. And a lot of times we have to tell them, we're the ones who tell them, like, hey, you're not doing good. We either have to do this or you're not gonna make it. And when they hold your hand and they look at you and they say, don't let me die. Or when someone says, I haven't slept in 3 days, I've been scared to close my eyes, I don't think I'm gonna wake up. And to have, I have children, please get me back to my family. It immediately just quenches your heart, because you know that once they go on that life support, they're probably not going back home. And you were the last person that they saw and that they got to talk to. And that has happened on more cases than I'd ever imagined I would experience in my career.
Knowing you have that, and there's a good chance that when you show up for work that day, you may have to experience that again.
Oh, every day.
What's your driving force? What makes you want to come back?
When we went into nursing, I knew I wanted to, since I was a little girl, this is what I've always wanted to do. I want to help people, and that's what we're trying to do. We're trying to help people the best that we can with as little of resources and staff as we can, and not having the capacity to be able to even properly care for these patients. Even though it's so hard to go to work every day, we still show up because our community needs us, and we're doing everything that we can to give them the best care and to be there. And if we didn't show up, if we just said, that's it, I've had enough, that's your coworkers, that's your patients, that's your people in your community who are going to suffer. So even though it gets so hard for us, I have a little girl at home, she's 15 months, and leaving her is the hardest thing that I have to do. And I just hope that one day I'll be able to tell her what happened and why I had to leave, and that she'll be proud of me. You work 4 to 5 days in a row. I did 60 hours last week, 5 days in a row, and that one day that I had off, I actually felt guilty, because I knew what my coworkers and what the people in our community are going through, and I felt a bit of guilt to sit at home and enjoy my day, because you know that there's people who are dying, and your coworkers are overwhelmed, and we just don't have the people that it takes to properly care for these patients, because the volume is it's so much. We just don't have it, and it's heartbreaking.
No one knows the severity of COVID-19 better than nurses and the folks in the hospital who knows what this thing could truly do. What would be your message to someone who hasn't really seen it all, and they haven't been convinced that this is a real reality?
If you haven't seen it, it's so hard to believe it if you haven't seen it. And it's so hard if you haven't been directly affected by, you losing a family member or a friend or someone that it's so hard to say this virus isn't real, this isn't, as bad as you're making it seem. And not one single virus should take over an entire ICU. It shouldn't. Not one single virus should take over almost all of the beds in a state at one time. It shouldn't. To be safe from this virus is to protect ourselves, to get vaccinated, to wear the mask, to practice social distancing until we can get through this phase. You know, we understand that viruses are very smart. We know that their goal is to mutate and come back, and that's going to happen. We're going to see that. There's going to be more variants, and if we don't stay on top of it, this can continue to keep happening. Not just with Delta, but whatever the next variants are, it can continue. And if we don't do everything that we can, then our community's never going to get through it. Our world's never going to get through it.
Any thoughts that you'd like to share?
I think there's a lot of misinformation out there. I think that, stuff can be misleading. Stuff can feed people's emotions, and they want to believe what they see in a post that's shared, but that's not the true facts. I think that if we were able to show them what we see, the amount of unvaccinated versus the amount of vaccinated, and how different the survival rate is in these patients and what we're seeing, I think that people would understand, it truly is, it does make a difference, that the numbers that we see do matter, and we've lost so many who are unvaccinated, and we have a weapon now to fight this virus. We have it. It's in our hands. We understand that there's fear, and on both parts, so fear with the virus or fear with the vaccine. We understand that. We're human too. We know and we understand. But if we don't come together as a community and as a whole, and we don't do what we need to do to stop this spread, to slow this virus down, our hospitals are going to stay overwhelmed. We're not going to be able to care for everyone who comes through the door. We're going to have to turn people away, and that might be your loved one, your family member. We really, truly, truly, as nurses, as doctors, as health professionals, not being to care for everyone is so defeating. It's so defeating. And if we don't find a way to lessen the strain on our healthcare system, we'll just continue to lose patients. And the way to do that is to get vaccinated, to wear our mask, and to help slow the spread.